be. So let's start right away with what does Pharmacare mean to you and the Arthritis Society?
Well, I think that's the right place to start, so thank you for the question. When we start thinking about this, we always come at it from the perspective of patients. There's lots of stakeholders with lots of interests, but our view is we have to start with the perspective of patients, and all of these issues around healthcare are about improving health outcomes for Canadians. We have to be grounded in whether or not any changes we make in the healthcare system are going to improve health outcomes. And so that's the why, because what and how really flows from why. And so in terms of the why, then you have to say, okay, in order to improve health outcomes, what does a Pharmacare program have to do to improve health outcomes? And we think about it as about three fundamental issues: access, equity, and affordability. So if we're thinking about Pharmacare, we want to ensure that every Canadian has equitable access to their medically necessary treatments wherever they live in Canada. So what does that mean in terms of access? It means that we need to ensure there's a broad range of treatments available. If you think about arthritis, there are over 100 types of arthritis, 6 million Canadians. And for inflammatory arthritis in particular, one of the concerns is that there are many new treatments, biologic formulations, where each biologic interacts differently with you depending on your genetic makeup. So we have to be careful not to think we can save money by listing just one drug in a class. We need access to a broad range of treatments if we're going to be serving the needs of Canadians. Secondly, equity. You mentioned earlier the issue of what I call the postal code lottery, where depending on where you live, public plans provide different kinds of coverage. We have to deal with the equity. And of course, affordability. It's not good enough to know that drugs are listed if in fact, as a result of copays, deductibles, or other kinds of limits, you can't afford your treatments.